The man known for the funny lines on the hit show Full House is receiving treatment for non-Hodgkin's lymphoma. Dave Coulier revealed his diagnosis yesterday on the Today Show.
Said he's already had 3 surgeries and chemotherapy. Said he wanted to share the story to inspire others to get tested early. So, of course, we bring in our 9 News health expert, Dr. Dave Coulier, to talk about this form of cancer. So what is lymphoma?
Lymphoma is cancer of the immune system. So our immune system is called our lymphatic system. It's our lymph nodes, it's our spleen, it's our tonsils, and it's our bone marrow. That's kind of the immune fighting cells that come from. So when you get a cancer of this, that's called a lymphoma.
So how does that present? How do you learn you have it?
Yeah, so sometimes it can be really tricky or indolent. So some people might just have painless lumps or bumps, kind of where the lymph nodes are around their neck, in their groin, in their armpits, or even the ones inside the body. So it could be incidentally picked up on a CT scan. People that have more aggressive lymphomas can have what's called B symptoms, which are fevers, night sweats, and unexplained weight loss. But for some, it'll just be as simple as fatigue. If your spleen starts to get big, you can see your abdomen come out and get distended as well. We know in Dave Coulier's case, he actually had these painless bumps that occurred after an infection. So he had an exaggerated lymph node response to an infection, which is what told his doctors, triggered them to know that he had a lymphoma.
Because you kind of fight it off in your immune system, an infection, right? And so if it's not working, it might be a sign.
Right, so when you have an infection, the immune tissue wakes up, so your lymph nodes get bigger. Sometimes it's painful. You can feel kind of tenderness in your neck after a sore throat or something, but it should resolve. So those immune cells should go back down and quiet down when the infection is cleared. If you're persisting to have lumps or bumps, that's called lymphoma.
Most people simplify it. It's cancer.
It's cancer.
But non-Hodgkin's, it sounds like a qualifier. What does that mean when we're talking about lymphoma, but in this case, non-Hodgkin's?
So there's a classification system, Hodgkin's or non-Hodgkin's, and it tells doctors how to treat you, basically. And it's essentially the presence of a specific type of cell in your lymphoma. So non-Hodgkin's is an umbrella term for many different types of lymphomas. B cells, which are antibody-producing cells, 85 to 90%, that's what Dave Coulier has, or T cells, which are cells that fight infection another way, that's only about 10%. And it helps us to know how aggressive your lymphoma is, because paradoxically for lymphoma, sometimes the more aggressive it is, the better it responds to treatment, because the cancer cells are so fast dividing that they can actually kill them more quickly. Some people have what's called an indolent lymphoma, which means really slow growing that can linger for years and years and years.
So he said his is stage 3. He talked about that. He also talked about the surgeries and the chemotherapy. Surgery, what do they do?
Yeah, so stage 3 means that you've got lymph nodes on both sides of the diaphragm, but you don't yet have involvement of your bone marrow, which is a good thing. So it's not widely spread. So even though it sounds very advanced, it's different. This is called a liquid tumor as opposed to a solid tumor like breast cancer or colon cancer. So stage 3 in lymphoma, thankfully, doesn't portend as poor a prognosis. Now, the actual lymph node, if it's pushing on something, sometimes they'll take it out, or biopsy could be the surgery he had. They use chemo. That's the mainstay of treatment. He's going to get chemo every 3 weeks for several rounds until February. And then sometimes they'll use radiation as well, targeted to areas to help shrink that lymph tissue if it's pushing on something or it's causing pain or what have you.
You mentioned the bone marrow. Is that the natural progression? If the cancer were to accelerate or expand, it would find its way into bone marrow? And that, can you defend that?
Yeah, so when it gets into the bone marrow, that's kind of the equivalent for a liquid tumor of really advanced stage cancer, from what a solid tumor would be metastatic disease. The only way to really fight that is something called a stem cell transplant, where you actually kill that person's entire immune system and either give them back their own immune system, which could have the risk of giving back some cancer cells, or take immune system from a match, a stem cell match, give them those stem cells to repopulate the bone marrow with a new immune system.
Quickly, just because he wants people to be tested. How do you get tested?
So lymphoma we don't screen for because it's pretty rare. We don't have a great blood test for it. But the idea that he's raising here of screening for cancers, including lymphomas, if you're having unexplained fatigue, you've had weight loss, you're having night sweats, talk to your doctor. Those are the people we would check. We don't do population-wide screening. But for solid cancers, breast cancer, cervical cancer, colon cancer, we've talked about this, screening saves lives.
All right. Thanks, Dr. Coulier, as always. Of course, you can get more with Dr. Coulier at 9news.com/Dr. Coulier.